Hello, and welcome to this episode of Hampton Roads Business Live. My name is Rory Graham, and I'm your host. And today I have the pleasure of having with me Amanda Hayden, Dr. Amanda Hayden, from the Centerville Animal Hospital. Welcome.
Glad
to have you on the program.
Thanks for having me.
I admire vets. I have a niece that is a vet, and I admire anybody who loves animals. I would love to be able to work with them all the time too. But why don't you kind of give us an overview of what is the Centerville Animal Hospital?
Centerville Animal Hospital is a full-service veterinary practice. Mm-hmm. So within the practice, we have medical services. We have a working pharmacy. We have grooming. And we have boarding as well.
Oh, really?
Yeah, and we have obviously surgical services, and well, at this point we're also offering for our established clients in-home euthanasias for patients that we've predetermined to have a terminal illness as well.
Okay. All right. Well, my next question here is, what is the best part of your day as a veterinarian?
The best part of my day?
Yeah.
I think it varies. I'll give you an example.
Okay.
Yesterday, one of our clients, who's been a client of ours for many years, brought in a dog that was having dystocia. And dystocia means that she's in labor and is unable to deliver her puppy unassisted. So she presented to us about 4 o'clock in the afternoon, and her first delivery was obstructing her birth canal. So none of the other puppies could be delivered either. And my associate veterinarian, Dr. Betty Rydell, repositioned the puppy and did an assisted vaginal delivery, which went very well. And my staff resuscitated the puppy, and it did fine. But the next 5 hours were spent with the owner in our ICU unit, made into a maternity ward, essentially, with no delivery of any other puppies. And we knew that there were 3 more in there. So at about 9 o'clock last night, we used our Doppler to listen for heartbeats, and they were on the slow end of the spectrum. And I then ultrasounded the mama dog, and we discovered that the heart rates were in fact in that kind of range that suggests that the puppies are in some level of distress. And so communicating this with the owner, and sort of the standard is maybe 6 hours of labor in between deliveries where you would maybe be concerned for the viability of the fetuses. So they elected to proceed with a C-section. So at 9 o'clock at night, I had a contingent of my staff stay with me, and we performed a cesarean section on this dog and delivered 3 additional puppies, and 1 personnel assigned to the resuscitation effort of each puppy, and we fully recovered her, and she was discharged at 12:30 in the morning. And at 1:30 in the morning when I left, I still had...
you look remarkably good for being up all
Thank you very much. It's not unusual, and I still had staff members there, of course, cleaning the OR and preparing the hospital for the following day. So I think it was rewarding for everybody. And my one of my youngest employees is a licensed veterinary technician student, and she'd actually been on the premises for 18 hours. And by the time her day ended, so
she was ready to go home.
She was ready to go home, but everybody was smiling. It's very rewarding. I love doing stuff like that.
So then I have to follow this up by asking you, what is the worst part of your day?
The worst part of my day. So over the years, we develop relationships with our clients, and we get to know them, and they get to know us. And give you an example of a client of ours who had a dog that had been through a lot of illnesses in her short life, to include distemper virus. And they had nursed this dog through neurological manifestations of that virus, which she did eventually recover from. And, got her to a point where she was having a great quality of life, and unfortunately she was stricken with cancer in her skull, her cranium. And I referred her to a board-certified veterinary surgeon, and he removed the tumor, and unfortunately it recurred after, a period of months. And she went to NC State, and they did radiation therapy on her with the idea that not that they would cure it, but that it would slow the progression of the tumor. And unfortunately, while it did slow the progression of the tumor, we were faced recently with quality of life issues for her, because as the tumor was progressing, it was impacting her vision. She was starting to have seizures and manifestations of anxiety that the owners felt like her quality of life had deteriorated enough that we needed to discuss.
It's really bad because they don't know what's going on. I mean, the dog doesn't
She
know what's
didn't.
happening, and you can't talk to them, and it's really hard on the owner too, because there's no. I went through a thing with a golden retriever, so I know.
Well, she was a golden retriever, so
well,
you can now picture this.
Yeah.
Yeah, and she's, the owners had navigated another dog that had visual deficits as well, and so this wasn't the issue that she was going blind. It was really the entirety of all of her clinical signs, which really had caused a deterioration in her quality of life. And at a middle age, she wasn't an elderly dog either. They had to face the decision about euthanasia, and it was agonizing for them.
Right.
And it was hard for us, because having gone with all of these issues with them, it was very hard to say goodbye.
The family and the dog.
Absolutely, and through multiple pets that they've had over the years, and entrusted their care of their pets to us. And subsequently, they actually apparently had acquired quite a lot of toys for this dog over the years, like quite a lot. And they asked could they donate them to us, and so we said sure, bring them in. And they came in with like bags and bags and bags. So we established a little room for her toys, and one of my employees made a box and put wrapping paper all around it. And since I don't have permission to say her name, I'll say Sadie. It became Sadie's Toy Box. And then whenever a client comes in and they have an exuberant, vibrant pet, we'll say, would your pet like a toy? And then we go to Sadie's Toy Box and bring them a toy. And it helps us to remember her, which is kind of cool.
Oh, that's touching. So what sets you, I can tell one thing already, what sets you apart from other veterinarian practices?
I'd have to say probably our staff, because we have very educated staff at our practice. I would say the vast majority of them, with few exceptions, either are currently enrolled in an educational program. Most of the time those educational programs are veterinary centered, either a veterinary assistant certification program or licensed veterinary technology courses. And we have a huge number of college degreed employees. So we put them through a pretty rigorous application process, and in an effort to try to screen applicants for their professionalism, their customer service, their compassion, and their passion, not only for veterinary medicine and animals, because I like to think we all love animals, but we have to love the people that are attached to them, because the animals don't drive themselves. And the people, they need our attention too. Sometimes we're just helping them navigate some pretty difficult times in their lives. And so that's our motto, helping pets and their people.
That's cool. Okay, so the Centerville Animal Hospital, I know that you just had a milestone.
We did.
I know what it is. You want to tell us about it?
Yeah, we've been in business for 20 years. I don't know how that is, since I'm only 20, but I started the practice 20 years ago.
Oh, that was, you had to rub that in, did you? Okay.
I started the practice 20 years ago, and I had one employee at the time, and she worked until 5 o'clock most days. And so after that, my husband, who's a nuclear engineer and knows nothing about veterinary medicine, would come after work, and he would answer the phones for me until we closed at 8 p.m. So that was a different era of veterinary medicine. It's not quite like that anymore. We now have 22 employees.
Wow.
And
No
my
idea
husband
that
was
big.
no longer working for me after a few short months. And I think veterinary medicine in itself has evolved because, back in those days, you might use a human reference laboratory as an example, like a human hospital. Back in those days, it was actually Virginia Beach General that ran blood tests and things for us and did biopsies. Now we use an exclusive veterinary reference laboratory, so samples are picked up by a courier and flown to another state where veterinary pathologists review the slides. Hematology is done by veterinary professionals. Now we have the incorporation of lots of technology that didn't exist back then. When I first opened, I was proud that I had an automatic processor for my x-rays, that I didn't dip them in tanks. Now x-rays are digital, all of them, and you don't put them up on a view box because there's nothing to hold. It's literally up on a computer screen, which is neat because you can email them to clients or referral doctors. We now have ultrasound, technology that wasn't prevalent in private practice back in those days. We have.
So it makes it more accurate and easier.
Yes,
faster.
it does, and then a complete in-house laboratory. So if we have a patient with an emergent condition, like our little C-section patient last night, we did pre-anesthetic blood work right then and there. We had it all done and all our answers within 30 minutes. EKGs are transmitted using a modem to board-certified veterinary cardiologists who interpret them for us and email us results. And we were one of the first practices in the area to become paper light, meaning we had charts, but a lot was integrated into a computer. And by 2006, we were completely paperless. And so we cannot lose your chart. It's all electronic. And the laboratory test results are integrated into the patient's file through the internet, and all the x-rays and everything are right there. So you can't lose a record.
That's cool. That's pretty advanced. Sounds like Centera.
It is. And as a matter of fact, we have a portal, the way you might have Centera My Chart.
Right.
We have a portal where you can log in and see your pet's test results right there. When was the rabies vaccination given? And, God forbid
And is this a customer portal or your doctor portal?
The patient's portal, actually.
Okay, so it's like My Chart.
Right,
so
exactly.
You go and see your own stuff, so that's cool.
Yeah, so God forbid you end up having to go to an emergency hospital type environment, or you're out of town and you need to have emergency services done someplace else. You can literally log into your smartphone, username, password, and we have we have an app now that even will save your username and password. You put 2 buttons on your smartphone and you're right into that patient portal too.
Wow.
And you could take a picture of your pet's heartworm prevention. It goes right to our pharmacy, and we know you need more heartworm preventative filled. So lots of stuff that didn't exist back 20 years ago.
I was going to say not 10.
Yeah.
10 years ago that
Good
didn't
point.
exist. Yeah. So that's quite high tech. All right. So what is one of I have on here asking what is one of the most important things that you want pet owners to know about Centerville Animal Hospital? And I think you certainly sound quite unique about a lot of the stuff that you do. You're on the cutting edge and all that. So what is one of the most important things you want them to know that you haven't talked about?
I guess I would have to say that while technology is important, and probably there are other practices that have technology and incorporate technology, I think relationships are more important. And I've had more than one client say to me, I wish the level of human veterinary care that I receive matched the level that you provide in your practice. And I wish I had the relationship with my doctor that I have with you. And that's really touching. That means a lot. When somebody tells me that, I feel like we're getting something right. And I think it is about relationships. So when we look towards big box type of environments for convenience, maybe, I guess I want to emphasize the importance of relationship and the fact that if I've known your pet for 15 years and I know what you're looking for in terms of the standards of care that you want for your pet, then I'm going to provide that to you.
And I guess earlier when we were talking, you were saying that you're treating the pet, but you also get to know the owner, and the owner and the pet are like connected, obviously, but it's important to have a relationship with both in order to do a good job, or the job that you all do. So I thought that was really unique.
Absolutely.
Yeah. All right, was there anything I haven't covered?
Well, we are an AHA accredited practice. That sounds funny, AHA, but it's the American Animal Hospital Association. And the American Animal Hospital Association only has 3,498 practices in the entire U.S. that it accredits. Now, people become members of AHA, which means that they support AHA and they support their standards, but doesn't mean they've met their standards. So there's a difference between membership and accreditation, and we've been accredited since 2006. So the standards put forth by AHA, which include 1,000 different standards, literally, we meet those and exceed those that are required by the Virginia Board of Veterinary Medicine. So as a matter of fact, we're going to be going through our next AHA inspection in January, where they'll ensure that we continue to meet and exceed those standards. And so I would just encourage pet owners to look for practices that are AHA accredited, regardless of where they are and what city they're in, because they'll know simply by that accreditation that these practices meet and exceed standards put forth by the Virginia Board.
Okay, and just to wrap up things, you are a full-service animal hospital, everything from surgery, you have a pharmacy, you do grooming, you do boarding.
Yeah.
You know, there's not much you don't do, I don't think. Okay, very high-tech, very customer-friendly, very relationship-driven.
Absolutely,
right?
That's us.
Okay. All right, well, if you've got a dog or a cat or some other animal that you would that you love and would like to have some really great care for, you might want to check out Amanda Hayden and the Centerville Animal Hospital. Full service, as you just heard, and I'm sure they could be a help to you. They're in Chesapeake, and their location and contact information is at the end of this video, and it's also at the bottom of this page. So I thank you so much for coming in. It's very interesting,
Thanks for having me.
I wish you a great deal of success, but I can tell that you really love what you do.
I do.
You know, so that's always good when you find someone doing what they love.
I'll join Veterinarians Anonymous maybe somewhere down the road.
Yeah, thank you so much.
Thank you.
All right.
Bye.
Bye.